Medical Specialists Associates, making medical education more accessible.
Thank you for watching this video. This is a video about how to place peripheral IVs. And I think that this is important because when I learned how to place a peripheral IV, there was really no learning at all. It was the typical, well, just go put it in. And it seems to be like this assumption that people just automatically know how to put an IV in with no training. But there is a technique to the whole thing, and I think hopefully that you'll find some benefit out of watching this. So the first thing I want to show you here is different sizes of IVs. So let's take a look at the different sizes here. So the first thing I'll show you here is we have a 22, a 20, an 18, a 16, and a 14. So when people think of these IVs, they probably think that really maybe the only difference is the size of the bore. So this is the 22, which is the smallest bore here, whereas compared to the 14, and this is the largest bore. If you put the 22 in, you can only get so much volume in somebody because of the small catheter. You put the 14, you get much more volume. But in terms of placing the IVs, what I want to bring your attention to is this major difference. And that is that in addition to the sizes, take a look at the size of the bevels. The bevels are much different in size. My 14 gauge IV has about a 5 millimeter bevel, whereas the 22 only has about a 2 millimeter bevel. So what does that mean for me? That means that when am I going to get flash in my chamber? I'm going to get flash in my chamber when only 1 millimeter of the bevel is in, or here only 1 millimeter bevel is in. But let's take the 14 for example. If I got only 1 millimeter of the bevel in, I get a flash. If I think, oh, I'm good, I'm in, and then I go to thread this catheter, what happens? The catheter goes into the soft tissues and not into the blood vessel. Why? Because the entire bevel wasn't in. So the difference between knowing how to use these particular sizes is that if I had a 22, when I get flash at 1 millimeter, I have to say to myself, what I do is I have to push this in 1 millimeter more. When I'm in a total of 2 millimeters, then I can thread the catheter. When I have a 14 gauge, what I'm going to say is when I get in 1 millimeter, I get a flash up here, but then I have to know to advance another 4 millimeters, and then I can thread the whole catheter in. So let's now take this over to our model and see what this would look like in terms of a model, in terms of the practicality of placing this. So here I'm going to take my 14 gauge just for a demonstration. And here we're going to see really kind of excellent veins. But even someone with excellent veins here, they're a bit tortuous. And I don't want them to be tortuous because that makes it difficult to get the IV in a straight way. They're also a little lax. I don't want them lax when I put the IV in because I want them in a certain place where I have some more confidence to get it in. And also maybe in some people, this particular model doesn't have a lot of soft tissue. In some individuals that have maybe more subcutaneous tissue, the plane of the vein could be in different planes. That could make it difficult. What's one way that I could minimize all those factors? Well, what I can do is I can take, first, what I do is I'm going to put a tourniquet on. When I put a tourniquet on, it puts back pressure on these veins and they blow up, as you can see here. And then the next thing that I do is I'm going to take my thumb and I'm going to pull down gently on the vein. Now, what does that do? That straightens the vein, takes all that tortuosity out, and then also takes the slack out of the vein, so it's more kind of tethered. Notice where my finger is. My finger is out of plane. Why is that? My finger's out of plane because I want to be able to put the IV in completely parallel to the vein. All too often what people do is they'll have their thumb here and they're going to come down at an angle like this. And what they're going to do is when they try to get the whole bevel in, they're going to go through and through the vein and they're going to miss it. So again, the thumb is out of plane. So then here what I do is I start, I advance 1 millimeter, I get a flash. I know that this is a 14 gauge IV, so it's a 5 millimeter bevel. So then I have to advance another 4 millimeters to get the entire bevel in. Once I know my entire bevel is in, then I advance my catheter. then I'm in, and then we're done.
All right, so here we're going to do the practical portion. So here we have a tourniquet on. We've sterilized the area. Notice that her veins are a little curvy here, and they're lax. And so as we talked about, what I'm going to do is I'm going to pull down here and straighten out. See how that vein straightens out now? So now it's a smooth shot. The other thing is I'm using 20 gauge IV. This has about a 3 millimeter bevel. So I want to make sure that the whole 3 millimeters of the bevel is in before I advance. So pull down, thumb out of the way. So now I'm able to have a smooth entry. And with that smooth entry here, you're going to feel a small pinch. I come in, and you can see how the vein just moves a little bit. Now I'm in, I advance 3 millimeters, I thread the catheter, and we're done.
Thank you so much for watching and learning with us today. If you're interested in taking this class for credit, or if you're interested in our other services, such as our direct clinical care services, please visit our website at www.med-specialist.net or click on the link in the description below. Also, make sure you subscribe to our channel to stay up to date on our most current content and educational opportunities.